Lupus is a disease in which your immune system attacks the tissues in your own body. Your immune system is made up of white blood cells that defend your body against foreign invaders. Normally, when foreign invaders, such as viruses and bacteria, get into your body, some of your white blood cells identify them as foreign because they contain substances called antigens. This recognition causes some of your white blood cells to make chemical markers called antibodies. These antibodies attach to the antigens, marking the foreign invaders as targets for your immune system to destroy them. In an autoimmune disease such as lupus, your white blood cells mistakenly make antibodies to mark some of your own body's cells and circulating chemicals for destruction. When the antibodies attach to your normal cells, your white blood cells begin to attack them as if they were foreign antigens. Over time, this autoimmune response causes inflammation in the parts of your body wherever this attack is happening. Inflammation makes the blood vessels in the affected area expand and leak fluid, causing redness and swelling. The symptoms of lupus happen as your immune system begins to attack different areas of your body. You may develop a butterfly-shaped skin rash on your cheeks and nose. Small sores or ulcers may form inside your nose or mouth. You may develop arthritis, in which your joints become inflamed and swollen. When your fingers are cold, they may turn a blue or white color. This is called Raynaud's phenomenon. You may have pain during deep breathing caused by pleurisy, a condition in which the outer lining of your lungs is inflamed. Your white blood cells may create antibodies that attach to bits of your DNA from worn-out cells. The attached pair, called an immune complex, can lodge in your kidneys and cause inflammation. This disorder is called lupus nephritis. Flare-ups of any of your symptoms, even those not related to your skin, may be caused by an unusual reaction to sunlight called photosensitivity. Other common symptoms of lupus include extreme fatigue, headaches, fever, a reduced number of red blood cells in your blood called anemia, swelling of your legs, feet, hands, or skin around your eyes, muscle pain and weakness, and hair loss. Lupus is sometimes called the great imitator because its many symptoms are found in other health problems. There is no cure for lupus. However, you may prevent or reduce flare-ups by avoiding direct sunlight and wearing sunscreen outside. The sunscreen should have a sun protection factor of 55 or greater and block both ultraviolet A and ultraviolet B radiation. To treat your symptoms, your doctor may recommend a combination of drugs to reduce inflammation, such as non-steroidal anti-inflammatory drugs, or NSAIDs, and anti-malarial drugs. Your doctor may also recommend drugs that suppress or prevent your immune system from attacking the tissues in your body, such as corticosteroids.
I'm Dr. Stephen Baranowitz, and my office is near Philadelphia in Bala Cynwyd. One of the questions that every lupus patient asks is, what causes lupus? In the last 15 years, there's been very detailed and very convincing evidence of the cause. In order to explain it, I'm going to refer to a blood test which every lupus patient is exposed to. It's called an ANA, or anti-nuclear antibody. This is the first test that doctors order when patients are suspected of having lupus. And it indicates that their bodies are making antibodies, which are substances that bind to the nuclei of cells. Now, what's in the nuclei of cells, and why do these substances bind to them? In order to discuss that, I'm going to introduce a new term. The term is NUCOMs, or nucleic acid components. It refers to DNA, which is composed, as chemists know, of nucleic acids and the things that make them up. It's been definitively established over the last few years that these antibodies to NUCOMs are responsible for creating many of the worst signs and symptoms of lupus. For the arthritis, the joint problems, the rashes that occur on the skin, and the kidney disease. In the normal American diet, we take in a large excess of NUCOMs. These substances may be responsible for the flares, the worsening, which is generally thought to be unpredictable, which occurs in these patients. There's good reason to believe that reducing the excess of these NUCOMs, which comes in the typical American diet, will also reduce the signs and symptoms of lupus, including the rashes, the arthritis, and the kidney disease. In order to do that, I've created a new diet which markedly reduces the amount of these substances, but is balanced in every other respect that patients need. This diet is called DART, for Dietary Autoimmunity Reduction Therapy, and I'll be discussing it in more detail in the next video.
Let's look at the rare and usually benign conditions known as neonatal lupus in this MDTV Medical Moment.
Lupus is not a hereditary disease, meaning it does not come about exclusively due to genes being passed from the mother and father to the baby. Instead, an offspring might acquire a genetic predisposition to lupus, but it takes environmental factors such as infections, stress, or certain medications to trigger disease. In fact, only 5% of offspring born to women with systemic lupus erythematosus develop the disease. Besides family and environment, other risks relate to gender, age, and race. 9 times as many women as men get lupus, usually between the ages of 15 and 30. And 4 times as many African American women as Caucasian women are diagnosed with lupus. There are, however, some risks of complications during pregnancy that are genetically determined. These can be investigated by blood tests. Approximately 1/3 of women with lupus have antiphospholipid antibodies that interfere with the function of the placenta by causing blood clots that obstruct the flow of nutrients from mother to child. Another 30% of women with lupus have antibodies to a part of DNA and its surrounding proteins known as anti-ROSSA and anti-LASSB antibodies. These antibodies carry an approximate 2% risk that the fetus will develop a rare condition known as neonatal lupus erythematosus, which is usually transient and not life-threatening. Most infants develop a skin rash and blood count abnormalities that disappear in 4 to 6 months. In a more serious manifestation, infants with neonatal lupus may develop a congenital heart block that carries a 15% fatality rate and may require a pacemaker after birth. Throughout the latter part of pregnancy, a progressively slower heart rate in fetuses suspected of having neonatal lupus helps to detect this disorder. In those situations, it helps to bring a neonatologist and possibly a pediatric cardiologist on board to consult with the medical team. This has been an MDTV Medical Moment.
Stay where you are. MDTV will be right back.